So we're here with our emergency care. This is scenario 1A. The patient presents with a possible distal radius fracture. They fell on an outstretched hand. They're in the clinic. So the first thing I'm going to do with the patient is I'm going to assess the scene for any safety, just precautionary. Then I'm going to put on my protective equipment. In this case, we only have gloves. Next, I'm going to check the patient CMS. So I'm going to grab their finger and check for capillary refill. I'm going to get you to wiggle your fingers for me if you can. Great. And then tell me if you can feel this. Great. So next, we're going to move into our splinting. With our SAM splint, I'm going to place the patient's hand just like this, have them wrap around, and I'm going to grab some of my gauze, securing around the wrist, securing the hand first, and then proximal to the fracture, distal to the fracture, and then proximal to the fracture. Just making sure that we have this on here. And then I can come in with my bandage. I'm going to secure this just around here. Lift up the sign for me. Great, and then I'm going to check CMS again. So I'm going to have the patient bring their finger out, capillary refill, move your finger for me, and can you feel that? Awesome. So that would be the end of scenario 1A. We are going to take a quick commercial break here and undo all of this, and we'll move into scenario 2D. Or 2B, sorry. Can you slide that off? Right. So scenario 2B, patient presents to the clinic with a headache and they collapse in the waiting room. So first thing I'm going to do to come out and make sure that the scene is safe, I'm going to assess everything. Then next thing I'm going to do is make sure I'm wearing my personal protective equipment. Again, in this case, we only have gloves. I notice that the patient is on the ground, so I'm going to run over as soon as the scene is safe, and I'm going to support their C-spine with something underneath. At this point, the patient is convulsing, so I'm going to start timing when they started convulsing and when they stop. It's been about 4 minutes, let's say. The patient stops convulsing. I'm going to take the patient here, lift up their leg, and I'm just going to roll them onto their side. And I'm going to wait here with them. 911 would have been called if the seizure had lasted for 5 minutes or longer. In the scenario, the patient has a history of seizures, so 911 does not need to be called right away. And we're going to sit here with the patient, let them sleep, let them rest, and when they wake up, we're going to reevaluate again. And that's scenario 2.